And a very good afternoon, goeiemiddag Molweni. You are still tuned into Sakhisizwe, Building the Nation Podinasi. And as you know, it is a Monday, so every Monday we do focus on anything to do with health-related issues. Engage with us, 061-862-1065. So the sounds that we played just now is the sounds by Ella May called Hide, which brings us directly into our first interview for today.
Yeah, so hundreds of people in South Africa struggle with cystic fibrosis, which is a life-threatening disorder that affects the lungs and the digestive system. Treatment for the condition exists, but the cost for the treatment creates a barrier that makes it virtually non-existent for many South Africans. Other issues with access to the disease treatments for the disease exist in location as well. Breathtaking Fundraising, NPC, is a non-profit organization that helps South Africans with cystic fibrosis to access medication and treatment, simultaneously raising awareness about the condition. To fill us in on the details of the foundation, Sakhisizwe is speaking with cystic fibrosis survivor and Director of Breathtaking Fundraising, NPC, Maré Smit. How are you doing today?
I'm very good. Thank you so much for having me for your interview.
And it's only a pleasure to be speaking to you today. So, Maré, if you can just give us an overview of Breathtaking Foundation, like what inspired it, how it basically arose.
Yes, I think the first thing to point out to people is that cystic fibrosis is a rare disease. And patients are not able to get into contact with one another due to cross-infection risk and ending up in hospital. Most patients are young, and if they get older, they need to be hospitalized more frequently or end up on a lung transplant list. And the only way we were able to access medication called modulators, which are currently the most effective treatment for cystic fibrosis, was to fly to Argentina in person and collect that medication. So at the time when we started the non-profit company, we realized it's really hard because most patients are either too young or too sick to collect the medication themselves. And that's where we came in, and we trained families and other volunteers to collect on behalf of other patients. And also we took the hands of these families and ensured that we went through them through every step of the way and ensured that the medication ended up safe with the patients in South Africa. Yes, and that's the reason we started. But part of that, we also realized that for most families, it's so hard coping with the disease and managing the disease that we thought it's a good idea to help them with fundraising, and so we created a crowdfunding platform for these patients.
Maré, and would you say that is also one of the reasons why you chose the name Breathtaking, because it has to do with the lungs?
Definitely. I think the reason we chose Breathtaking as the name is the disease itself is breathtaking, but we also want to say to people and inspire patients out there with the words that even though you face a disease that's breathtaking, life still remains breathtakingly beautiful with all the struggles, all the hardships that one goes through. You can still enjoy the small and good and precious moments in your life and still have a breathtaking life. And that's where we come in and say, but let's do events that are breathtaking, and let's make other people part of the solution and encourage other people to join with us and partner with us to help these patients in need of funds for medication.
Well, thank you so much for your work. Can I ask, what are some of the specific challenges that exist for people that live with cystic fibrosis?
Yes, I think there's quite a list of challenges. I think the first thing is it's really hard having let's say a typical life because the disease affects multi-organs. It affects the lungs, and many patients do have chronic lung infection. Most struggle with the absorption of nutrients and keeping their health tip-top so that they don't get sick regularly, but it's really hard because our digestive systems are affected as well. Many struggle with osteoarthritis, cystic fibrosis-related diabetes. So quality of life is impacted greatly with this disease, and many patients end up going to hospital every 2 to 3 months for 2 weeks at a time. Not only that, it's extremely expensive disease to actually have, because if you can afford a medical aid, most medical aids are more or less 10,000 rand a month for such patients minimum. If not, the medication and treatment is very expensive. So I think there's a lot of challenges to overcome, and also we've only recently gained access to the most effective treatment for cystic fibrosis, and there's still a huge price tag attached to that treatment.
Maré, and when we do speak about cystic fibrosis, like what are the symptoms that one needs to be aware of in order to know to be diagnosed? And also, is there other illnesses that also mimics or has an impact on cystic fibrosis, such as asthma or so forth?
So I'm not a medical professional. I just want to point that out. But what I can share with people out there is that, first of all, this is an inherited disease. You get it if your parents are carriers of the cystic fibrosis gene. And then, secondly, sometimes this is not diagnosed until the age of 3 or 4, when there's already permanent damage done to the lungs or the digestive system or even the liver. And so what I would like to point out is some of the symptoms that patients do struggle with even before and after diagnosis are definitely recurrent lung infections. So when your child has recurrent lung infections, struggle to pick up weight, so malnutrition and failure to thrive as a baby can be part of it. Sometimes it looks like having reflux even, but most common we see that people do struggle to thrive and pick up weight. And then some other symptoms that we do see coming through is that people also struggle, obviously, to have normal bowel movements. So they do struggle with constipation or diarrhea even. And part of that is that most patients have a salty tasting skin or sweat, because we do secrete more salt than other people when we are sweating. So that could also be an indication to just inquire from a doctor, what are the chances of my child having cystic fibrosis, and then they'll do the necessary screening tests.
Yes. So can you go into detail about, can you elaborate? You talked a bit about the limited access to medications for the disease, but can you elaborate on those medications that are available for the management and treatment of cystic fibrosis and the specific ways that they work?
So most patients in South Africa do have access to bronchodilators, mucolytics, and many inhaled medications that are prescribed by a doctor, and that's just to help with airway clearing and getting the mucus out, because we do have thicker and more sticky mucus than other people, and that is what causes bacteria to sit and get stuck in our lungs and cause a lot of havoc. So part of that treatment that patients receive also includes some enzymes that we take to help us to absorb valuable nutrients and grow better and stronger. Yes, I mean, the therapy that gets added to our daily routine often is physiotherapy, chest therapy, and then also most of us do have a dietitian on board so that we ensure that we eat healthy and maintain our health. I think most recently we have access to modulators in South Africa, and that is in a tablet form, and that addresses the root of the cause of the disease. So this medication literally helps our mucus to be as normal as possible and not create this area and that create a sticky area for bacteria to get stuck in and lead to further chronic infections.
And you still tune into Sakhisizwe, Building the Nation, Bodinasi. We are speaking to Maré Smit from Breathtaking Foundation, and she's just been telling us a little bit more about cystic fibrosis, as she is a survivor of cystic fibrosis. So, Maré, you earlier spoke about how, the accessibility when it comes to, or how expensive it is to basically get the medication. So, when we do look at the medication currently here in South Africa, and you also have, or rather you went on Pick a Buddy to raise funds for this. So how do you, as Breathtaking Fundraising, plan to use external donations to address the gap in accessibility?
So first of all, we are able to use that funds to help patients to afford medication or medical treatment. Some people are just short of a few hundred to get onto a medical aid. Some need extra money to actually afford the most effective treatment, because that is 400,000 rand per year per patient. And not all medical aids do reimburse patients for that medication. And this is what we use it. Also, we use it in negotiations for generics and getting it at a cheaper price from abroad. But that's mainly what the money is used for.
And also, is it accessible in the public healthcare facility? Because like you've mentioned, you need to be able to have medical aid, which is quite expensive. So if we maybe look at someone that's coming from the townships or Cape Flats and so forth, is there a way to move past this so that they are also able to have access to the medication?
Currently, I think due to the price tag, they don't have access to it. And this is where we want to come in. We've already started collaborating with the Department of Health in the Western Cape to ensure that we do address raising awareness of the disease, and also we want to see earlier detection of the disease and see if we can decrease the age of which the children get diagnosed, usually in government. And then the other thing is also sometimes we do have philanthropists or businesses that prefer to sponsor a patient, and that's where we take hands with philanthropists and businessmen to see if we can support such patients in government.
So, I'm really curious about what the long-term goals of the Breathtaking Fundraising Foundation are as it relates to improving the lives of those affected by cystic fibrosis.
Mm-hmm. So our vision is that everybody in South Africa living with cystic fibrosis should have access to the most effective treatment of cystic fibrosis. And then as part of our vision, our mission is to help and support patients living with cystic fibrosis to raise funds for the medical expenses.
And then just in conclusion, anyone that is currently tuned in now that want to know a little bit more about cystic fibrosis, because this is also the first time I'm hearing about this, to provide more education on how to manage this disease, where can they go to get further information, or even if they want to donate towards the cause?
Yes, I think the best place to go to is to send me an email at Maré@breathtakingfundraising.co.za.
Thank you very much, Maré, for taking the time to speak to us today. Are there any additional words in closing, and also words of motivation as you are a survivor? So for someone that is maybe struggling with this disease and don't know quite what to do, is there words of encouragement that you can convey on to them?
Yes, I think at this moment in time, the best thing that patients can do, and also families with little children who have been diagnosed recently, is do your best in doing all the therapies available and keep your lungs as healthy as possible. Eat healthy, and attend your clinic visits. Listen to what the doctors have to say. So that's the best way to go about it. If you can take care of your lungs as long as possible, that's the best chance you'll have at surviving. Try to lead a healthy lifestyle, obviously with exercise if possible. And then I think it's important to network or just like reach out to us, where and even the South Africa Cystic Fibrosis Association, also known as SACFA, they do have support groups. We all have support groups that we can network with and ensure that you feel supported and you don't feel like you're doing this all on your own.
Thank you so much for doing this interview with us today and teaching us a bit about cystic fibrosis. I know I definitely learned a lot, so thank you so much.
Thank you for being able to share the story, and I hope you all have a lovely afternoon.
You as well. Goodbye.
Goodbye.
So that was Maré Smit from Breathtaking, and she was just speaking to us a little bit more about cystic fibrosis, as she is a survivor of this disease. And as she mentioned, there is support groups available and also forms of creating more awareness around cystic fibrosis, as it does affect children as well.
And foundations like Breathtaking that are, doing the work to try and bridge that accessibility gap when it gets into some of the medications available.
Yeah, because it's quite expensive, like
Definitely.
Who knew? And what she also said is if you don't have medical aid, you are going to suffer. And then there's the other issue also, does your medical aid even cover the treatment plan? So yeah, they are doing fundraising, and they also are on Packer Buddy. So if you want to donate towards the cause, feel free to go via the social media, and that is just Breathtaking Fundraising, and that is where you will find them.
Thank you. Yeah.
So right now we'll go into the sounds by Feel So Good, and that is going to be taking us to the isiXhosa news at 1 o'clock with Isobusi. Keep it locked to Bush Radio 89.5 FM.